South Florida Intervention, and I'm coming to you this morning from New York City. I'm in the Bowery, Chinatown, and behind me is a great view of the city. I don't want to adjust the camera because if I do that, I'll never get it back into this position. But back here, you can see the Empire State Building, Midtown Manhattan, everything. It's really cool. It was really cool staying here last night. I want to talk about something I did yesterday. The day before Wednesday, I delivered a young man to Turnbridge in New Haven, Connecticut, which is an education program, which I reported on earlier, for young men and women. Less so a treatment program than an educational program. Very impressed, really loved it. I visited there about a year ago, and I really been looking for somebody who would be a good fit for this program. And I was delighted to have met this family in South Florida that really fit that profile, and I'm just so excited for this young man to be there and to follow his experience. I think it's going to be really fantastic for him, and I'm really excited about that. So after I got up yesterday and had a brief workout and got ready, got showered, I went to visit another treatment program, extended stay treatment program in Madison, Connecticut. It's right next to Guilford. It's called Wildwood Farm. It's a program specifically designed for the LGBTQ community. It's what they call queer normative. And it's really important because there are a lot of programs out there that have add-ons where they serve a gay population or a queer population, but it's not specifically what they do. And I run into this a lot in other areas too. For example, you might have a young woman who has an eating disorder and a drug addiction, and you reach out to a treatment center, and they say, oh yeah, we have a track for that. We have for eating disorders, and that's true, and they do, and they can be helpful, and they're definitely informed, but it's not what they're known for. It's not what they do, and the same exists for the queer community, which to my surprise, I did not know this, but the term queer is now very acceptable. When I grew up, it was slander. It was not an accepted term, but apparently now it is, and it really encompasses the blanket of the entire LGBTQ community. So this treatment center specifically treats young, well, not young, but anyway, gay men, gay women, women and men in transition, people that have questions about their sexual orientation. And I met the folks that run this place last year in Salt Lake City at an intervention conference. The founder is Dr. Michael Hinckley, and he spoke at the conference, and he's just one of these guys I could have listened to for hours. He just has an amazing history. He worked with Mother Teresa early in his career. He was a parish priest, a Catholic priest, for years. He tells an amazing story about working with Mother Teresa and her finding her higher power, which is just a mind-blowing story, fascinating. And he talks about working with, another story he talks about working with men in the early 80s in Washington, D.C., dying of AIDS. And when he gets to this hospital or hospice that he's working at, the person running the hospice gives him this advice. He says, never be, he says, how should I act with these patients? How should I be? And he says, Michael, never make yourself more and never make yourself less. Just be there with them. And I think that is just such fantastic advice, because so many times we're sitting with somebody and we're trying to help them, and while they're talking, while they're sharing how they feel with us, we're either thinking, we're trying to position ourselves, how do I help them? How do I do this? How do I get in on this? And the answer is quite simple. It's just be there and listen. Something I do, there's a little bit of a sidetrack, and I am known for my sidetracks. Something I do is I will often hear somebody who's telling me how they feel about something, and I'll ask them, and I'll say, how do you want me to be here for you today? Do you want me to be a good listener? I can do that. Or are you looking for a solution to the problem? Because I could do that too. But tell me what you're looking for. And sometimes people just want you to listen, and that's great, and you just sit and listen and be compassionate. And sometimes people say, no, I really need a solution. And then you can sit and listen, be compassionate, and then offer some suggestions. But there's that expectation is set in advance, and I think that's great. So I met these guys, and Michael's chief operating officer is a guy named Matthew Gallup, who's also fantastic. And I went to the farm yesterday because I was nearby. I wanted to experience it, and again, it's one of these very unique places, very specialized. I was very inspired by what Matt and Michael had presented when we were in Salt Lake City, and I wanted to see this firsthand. And yesterday I had that opportunity, so I drove up to Madison from New Haven, which is just a short drive, I don't know, about half an hour. And the farm is absolutely, the settings, the grounds are absolutely gorgeous. I mean, it's this beautiful old farmhouse built in 1815, and they've got a real working farm. They have chickens, they have goats, they have pigs. They've got a couple of dogs running around that are herding dogs. Just fantastic. And they do gardening, they do woodworking. There's just a lot to, and then just getting out of the car and being on this farm is restorative. I mean, just getting out of the car and being there just made me feel like at peace. I just felt like I was in such a safe space. And we spent about an hour at the farm. Matt showed me around, introduced me to the goats, the chickens, and the turkeys. And yeah, I didn't realize the turkeys were so damn ugly up close, but they are. They're really these they're big and they're ugly, but and they're a protective animal. They kind of came together and grouped up at us, and Matt said, well, they really don't know you, so they're being protective. And then the pigs just are interesting. So great place. And then we got an opportunity to go and visit with Michael, Dr. Hinckley, at his home for about 15 minutes, which I didn't think we were going to get to do because Thursdays is a busy day for him, seeing clients, but we got to do that, and that was fantastic. And so where this treatment center I want to jump back. It's not really a treatment. It's not an acute treatment center. If your son, daughter, or a loved one is really acute, meaning that they drink every day, they have to drink or use just to function, that's acute. They can't go a day. They really need to be medically detoxed in a proper facility, go through a 30-day program, and then they would come to Wildwood Farm. If they are a drinker and drugger, but are not that acute where their withdrawal will not be significant, I think they probably could go right to Wildwood Farm, which is the case with a bunch of places. So this is kind of a long-term aftercare program, residential aftercare program, and people can stay there, I guess, a year. I know there was a case they said where someone stayed 17 months. But so if you have a son, a daughter, or a loved one, a sibling, or whatever, that is struggling with addiction, and they want to go somewhere, or you want to send them somewhere where they can feel like their homosexuality, they're being in transition, them questioning. Okay, I meet a lot of guys who tell me that they're not gay, but when they use, they have sex with other men. So and I said that yesterday. And Matt said, well, this is a great place for that, because it's a great place for people to figure out what's really going on, what they really are. It's a place where, being there and being queer is the norm. So that's the term that Dr. Hinckley has coined. It's queer normative. And so you're not the odd guy out. You are with your peers. You are at home there, and I even felt that being there, just sitting on the Adirondack chairs with Matt talking on the lawn. It really is a sense of peace, and I'd love to send somebody there that fits the profile, because I think they would get so much out of it. As opposed to going to another type of treatment program where most people are heterosexual, most people are straight, white or black, males or females. Instead of being the odd person, here you are the norm. And I actually identified with that a little bit. I was telling Matt, because growing up for me, I always felt like I was the odd guy out. I always felt like in school I was I was a little bit lesser than, or I couldn't keep up in school, so I didn't feel safe. I always felt like there was the entire population and then there was me. So I identified with it in that sense, that I know what it's like to feel like the odd guy out, and then get into a space that's comfortable and say, oh wow, I really belong here. And that is what happened to me when I came into the program, is that my first meeting I went to outside of treatment, I felt like I had finally found a place where I belong, where I could share what was going on with me, and people would do the nod. In a meeting, when somebody's sharing and people nod, they're identifying with what you're saying. They're identifying in. That's what that nod is. And I saw that, and I said, well, I'm safe here. And I think that Wildwood Farm is that environment for the queer community. So I want to give you their phone number and web address. This is their brochure, which I'm sure they'll be happy to send to you. It's a Wildwood Farm. The web address is recovery@wildwoodfarms.com, wildwoodfarms.com, and their phone number is 203-800-6159. And I'm going to try to post this all too. So post this to some LGBTQ community websites to get it out there. So anyway, that's really it. I want to share about this special place. I'm happy to be in New York City. I know it's COVID. There are a lot of things that's closed. I'm a little fearful in terms of what's going to happen to the economy here. I was in an Uber with my friend last night coming home from dinner, and the Uber driver says it's really quiet. It's quiet tonight. It's been quiet every night. There's a lot of stores that are closed, a lot of stores that have boarded up from the riots. And New York City is definitely going to recover. There's no question to that. But I hope it does it sooner than later, because it is the greatest city in the world. I would love to see it. And I'm from New York. I'm a New Yorker. Once a New Yorker, always a New Yorker. But we'll see. And my wife and daughter are actually flying in tonight, which I'm excited about. I was supposed to head home today. Today's Friday, and they were supposed to. I was supposed to go home this afternoon, but they're going to fly in this afternoon. We're going to spend a weekend here, a little further uptown, and just kind of hang out. We haven't been away all summer, so this is a great opportunity. This is a good opportunity for us to just kind of, get away from how it's nice and cool out this morning. So to get out of the hot South Florida sunshine and just cool off a little bit. It was nice to go out this morning to get coffee from my coffee place, and to have to wear a little light sweatshirt. That's one of the things I miss about living up in the north, is those sweater days, those boot days, little scarf. And even though it's August here in New York, it's a little bit cooler, which is great. So anyway, that's it. I just wanted to report in. I hope everybody's doing well. I hope you have a great weekend ahead of us. My website, again, is southfloridaintervention.com. Again, it's southfloridaintervention.com. And you can reach me directly on my mobile phone anytime if you have someone that needs help. It's 202-390-2273. Again, 202-390-2273. And our social media is @HelpForAddiction. So that's it. Have a great weekend. Thanks for watching this, and I look forward to connecting with you in the next video. Take care. Bye-bye.